Hello, everybody. Today, Ben and I are going to talk about the social history of HIV and AIDS, focusing specifically on the 2005 to 2009 time period. We will discuss the major developments from each year, focusing on medical advancements, statistics, policy, important individuals, and/or legal cases. This was a complex time period with a lot of hope, but also a lot of setbacks, which we will discuss further. In 2005, one notable public figure that greatly advocated for diminishing stigma of HIV and AIDS was former South African President Nelson Mandela. His advocacy was prompted by his son who died of AIDS. Nelson spoke about his son's death, saying, "Let us give publicity to HIV and AIDS and not hide it, because the only way to make it appear like a normal illness, like tuberculosis or cancer, is to always come out and say somebody has died of HIV and AIDS, and people will stop regarding it as something extraordinary." His advocacy in South Africa was important because HIV was still spreading rapidly in 2005, with 5 million new HIV diagnoses and 3 million deaths by AIDS, of which South Africa was a major contributor. Also in 2005, $8.1 million in funding was supplied to low to middle income countries. Although this was a great increase from previous years, even if funding increased at the same rate over the next few years, it would still be nowhere near enough funding to cover the needs in low to middle income countries, as shown in the table on the bottom left. Also in 2005, the World Health Organization announced the results of the 3x5 initiative that planned on providing 3 million people in developing countries with AIDS treatment between the year of 2000 and 2005. The chart on the right shows that their efforts did greatly increase the number of people who received antiretroviral therapy in developing countries during this time period. In 2006, evidence was found that linked HIV type 1 in chimpanzees from southern Cameroon. Here, specific antibodies and nucleic acids were found that support the idea that HIV came from chimpanzees, which was first introduced in the 1990s. The chimpanzees actually had a virus known as simian immunodeficiency virus, or SIV, which was transmitted to humans, possibly by hunters that came in contact with chimpanzee blood. SIV was then mutated over time to become what we know today as HIV. Also in 2006, the CDC released revised recommendations for HIV and AIDS screening. One of the notable changes was providing screening for HIV and AIDS to pregnant women, which was not the norm before 2006. Additionally, written consent was no longer required for HIV and AIDS testing. This is important because HIV and AIDS were no longer considered different than any other health condition. It was also recommended that opt-out HIV screening be instituted in all healthcare facilities. In 2007, the World Health Organization and the Joint United Nations Program of HIV and AIDS officially recommended circumcision as a preventative measure for acquiring HIV through heterosexual transmission. There were several studies performed leading up to 2007 that supported the claim that circumcision could help prevent acquiring HIV, including promising data from clinical trials. One such study found that circumcision could prevent heterosexually transmitted HIV by up to 60%.
Also in 2007, the Clinton Foundation, which was founded in 1997 by former President Bill Clinton to address climate change, promote economic equity, and to promote global public health concerns, really worked hard to negotiate a almost 50% reduction in second-line AIDS drug costs. In line with their mission, this really focused on developing countries like India and also some countries in sub-Saharan Africa that didn't traditionally have the same resources as other developed nations. In 2008, the Tom Lantos and Henry J. Hyde United States Global Leadership Against HIV/AIDS, Tuberculosis, and Malaria Reauthorization Act authorized an additional $48 billion of spending for PEPFAR. PEPFAR is really important in a number of different AIDS initiatives. This specific funding was used to increase access to testing services, to promote reduction of vertical transmission, and to train nearly 300,000 healthcare workers in the fight against global HIV and AIDS. A few other really important bits of this act, which was called the Lantos-Hyde Act, in short, it removed a blanket ban on foreign travelers who were HIV positive, and so this really allowed people to enter the country when they hadn't been able to before, and started to kind of tear down some of the stigma that had existed. This act was kind of reauthorized under President Obama, and the ban on foreign travelers who were HIV positive has been fully removed at this point. Additionally, in 2008, a bit of biomedical advancement at the Conference on Retroviruses and Opportunistic Infections, the case of the Berlin patient was presented. And so now we know that this patient's name was Timothy Ray Brown, but at the time he was anonymous. And so this patient was fully cured of HIV through a stem cell transplant procedure and was fully recovered and did not develop AIDS. He has since passed away. However, his case was really the first case where we could, medically show that it was possible to eliminate HIV. And so this was cause for a lot of excitement, both in the biomedical community, but also within the HIV community in whole. Fortunately, at this point, the advancements have not quite been where we thought they would be in 2008. However, there's still a lot of great research going on specifically around stem cells and the fight against HIV and AIDS. In 2009, there was some additional exciting and hopeful information released by the World Health Organization and the United Nations AIDS Epidemic Update, and this happened in November of 2009. This report pointed that HIV incidence worldwide had decreased by about 17% since their last report in 2001, and there were a few key regions that really showed a reduction in incidence. Notably, East Asia was down by 25% in incidences since 2001, and as I mentioned, other regions such as sub-Saharan Africa had also seen a sharp decline in their incidence rates, which correlated with a reduction in morbidity and mortality as well. An interesting court case that reappeared in 2009 was the case of Campbell versus the state of Texas. This was a gentleman who had HIV and was living in Texas at the time in 2006 when he was initially charged. And so he was arrested for disorderly conduct outside of a bar, and in the process of the arrest, spat on the arresting officer. And so this resulted in an assault charge, which was later upgraded to an assault with a deadly weapon charge. Prosecutors argued that Mr. Campbell's spit was a deadly weapon because he was HIV positive. Now, we know biomedically that that is not a reasonable assumption to be made and has been disproven. However, when his case came up to the appeals court in 2009, his charges and his 35-year sentence were upheld. And so the information that I could find points that he is still in prison today for that. Here are a few of our references. We'll leave them on the slide for a little bit so you can do some additional research if you'd like to. Overall, we just really hope that this presentation gave you a sense that HIV is such a complicated topic, especially in a social setting. And so we hope that from the 2005 to 2009 period, we've really introduced some of the nuances of the period and really gave you a better overview of what was happening and many of the important themes that existed throughout this time. So thank you so much.